My name is Mark Golledge. I lead the work at the Local Government Association around information and technology, particularly focusing on the role of adult social care and the interactions with health. We've had a really close relationship with the Centre of Excellence for Information Sharing, particularly over the last 18 months. As you're probably aware, the Local Government Association supports local authorities, and local authorities obviously deliver a whole range of different services. So there's a number of colleagues within the LGA and within local authorities that are engaged with the Centre of Excellence. There's obviously a national commitment to move towards integrating health and social care by 2020. And within that, obviously, a need to join up services that can support individuals, the patient, the public, the service user and the carer. So we've been working really closely with the Centre as well as other national organisations in terms of really sharing good practice that's happening at a local level, working with some of the new care models programmes which NHS England are running. And that engagement with the Centre has been really about understanding what good practice is happening across the health and care system and what can be shared more broadly with other health and care economies. Whenever we talk about information technology, we often talk around people, process and technology. And the people dimension, the culture and behaviours dimension is absolutely crucial part of that. So in our work over the last year, working with the Centre, that people dimension has been absolutely crucial in terms of building trust, not only across organisations, but also building trust with patients, with citizens and with carers as well. What we're starting to see a lot more is coordination of services around an individual. So when we're talking about health and care integration, for example, we're talking about how can those services better coordinate to support improved care and improved coordination of care for patients and citizens. And the interface and the engagement across organisations is really important in terms of building trust between those organisations. So the work we've been doing with the Centre has really been about exploring where there's good practice, where there's evidence in terms of some of the learning from local areas around where trust is not only being demonstrated and built across organisations, but also where trust is being, where there's a strong engagement with patients and citizens and with service users. So over the last year, we've been working really closely with a number of localities that have been focused really around understanding the purpose of why they want to share information. I think there's sometimes a danger that we can perhaps jump into an individual programme, and sometimes a danger that we may not give thought to actually what are we trying to achieve. And where there's successful initiatives, it's really based around some of the things like the Golledge principles and certain areas such as ensuring that there is clarity around the purpose for which information is seeking to be shared, and also strong engagement with citizens and with the public, particularly where there's a strong collaboration and co-design of those programmes and initiatives with patients and with citizens. So there's certainly, when it comes to health and social care, there is a strong emphasis around integration, a strong emphasis around coordination of care across different organisations, and the importance really within that of building trust across organisations, but importantly building trust and demonstrating that trust with individual members of the public in terms of how that information is shared. Over the last few years, I think we have really seen a shift in dialogue around information sharing. I think historically, perhaps information sharing has sometimes been seen as, we'll let the information governance leads focus on that. And I think we're starting to see a lot more of a focus around information sharing being the responsibility of everyone, whether that's chief executives or senior managers, through to practitioners that are delivering health and care at a local level. And I think that's absolutely crucial, that information sharing isn't seen as something we'll let someone else do, but actually there's a real focus in terms of understanding and not just protecting people's information and making sure the safeguards are in place, but that building trust and working collaboratively with different organisations. So I do think we've seen a shift of in the dialogue around how information is shared. I think from a locality level, we've done a lot of work with local areas, and we are seeing a lot more engagement at an early stage around thinking around what are people seeking to share information for. And really bringing some of the experts into those discussions at an early stage. Partly, I think there is sometimes a danger that programs might go off and design something, and actually some of those professionals are perhaps brought in at a later stage. But I think we're starting to see a lot more engagement at earlier stages around that process, which I think is absolutely crucial. And I think going forward, that's likely to be the case. Whether it's health and social care, whether it's devolution, whether it's joining and collaborating across different organisations, I think we are seeing a lot more of joining up services around an individual, around a member of the public to better provide services for those individuals, which I think is great. But obviously we need to ensure that information is safeguarded and that those safeguards are in place and that the communication happens with individuals. So I think the Centre of Excellence for Information Sharing is doing an absolutely crucial role in working with local authorities, working with public sector, in terms of engaging with those localities at an early stage and helping. I think sometimes it's useful to have a critical friend, useful to have some support that as you're designing or transforming services, you've got some support there and people that are drawing out and asking some probing questions around, around key elements to think of at an early stage that perhaps if you're designing a programme you may not be you may not think through. So I think the centres play an absolutely crucial role in terms of supporting localities at an early stage. I think the centres also playing a crucial role in terms of sharing some of that good practice across localities around what's working really well, and sharing some of that knowledge and expertise to other localities that they can support and adopt and adapt for their own local purposes. So I think absolutely crucial role. I think where the centre's also working really well is working collaboratively with other organisations such as the Information Governance Alliance or with NHS England or with other organisations that perhaps brings a bit more of the technical dimension alongside some of the culture and behaviours. And I talked before around how information sharing is that aspect around people, process and technology. I think the centre's role working in collaboration with other organisations is really helpful for local areas that are embarking on programmes or projects at a local level. So in terms of the future of information sharing, I think it really starts from the perspective of thinking about services and how services are going to be delivered in the future. We're already seeing a lot more collaboration at a local level. Services that are being designed and supporting an individual, supporting a family, and really focused on putting those individuals or families first. And I think we're seeing a lot more of collaboration across different organisations in terms of how they coordinate services and coordinate engagement with those families and individuals. So I think it's great that those organisations are putting patients, putting citizens, putting service users right at the heart of the services that are being delivered. I think that will undoubtedly lead to much more engagement across organisations, the need for closer trust between organisations, and ultimately will require us to think much more about how information is shared. I think it will require a lot more focus around thinking about how do we safeguard information, how do we keep information safe and secure. It will equally focus a lot more of the minds around how do we engage the public and how do we engage the citizens around how their information is shared. But it would also leads a lot more towards collaboration for the benefit of those that are receiving public services in the future. So I think it's positive. I think there are undoubtedly challenges. More information being shared means more need to focus on what are the safeguards that we need to put in place to protect information. And organisations need to really think about how they do engage with the patients, with the public, with service users as part of designing and transforming the way that services are delivered. So I think it's positive. I think it presents some challenges that we need to think through collaboratively, working across public services, how we best support that at a local level. So over the last year, we've been working really closely with a number of localities across the country around health and social care integration. We're seeing a lot more establishment of integrated teams, of multidisciplinary teams that are working collaboratively to support an individual's care. The Golledge report, the Golledge 2 report, talks about information and actually encouraging information to be shared where it's in the interests of the patient and where it's in the interests of the individual, the service user. And certainly those multidisciplinary teams, those integrated care teams, very much focused on supporting and collaborating across organisations to better coordinate the care and support those that are receiving care. So a number of great areas where there's activities that are happening at a local level, putting the person right at the centre of how those services are delivered and engaging them in terms of how their information is used as well. So with a number of examples around the country where there's some excellent work that's happening, some excellent engagement with members of the public in terms of how information is being shared, and it's much of really a two-way dialogue between service users, between organisations, and really engaging with service users as part of the design of those services. So over the last few months, we've been working with a number of localities across the country that have been collaborating around information sharing, and it's really, I think, helped unpack some of the key foundational principles, key building blocks really around where there's been successful projects. I think there's a number of those building blocks, one of those being leadership, and that's leadership from senior leaders, but that's also leadership across organisations. Another one of those is engagement and communication, so where there's really clear engagement and communication across organisations, and that there's a dialogue, and that dialogue is really an ongoing dialogue across organisations, that there's clarity on what programmes or what initiatives are being, what the vision that they're seeking to achieve is, understanding actually what information they need to perform what they're trying to do. But also really strong engagement with members of the public, strong engagement in terms of how information is being shared as well. So really for me, information sharing is about a dialogue between organisations. It's about building trust between organisations, but also about building trust with members of the public as well in terms of how their information's being shared. And I think as we look to the future, it will become more about that dialogue and that two-way engagement, both between organisations, but also with members of the public as well.